This is Rebecca Gathright, and I will be discussing how the gut microbiome impacts autism. These are the symptoms of autism: poor communication skills, which is pretty much everyone on the spectrum deals with this, and this leads to poor relationships with others, trouble learning, some behavioral patterns, such as making the same movement over and over again, and gastrointestinal problems. Each child is expected to have different symptoms based on the severity of the case. Some can be mild, moderate, or severe. There is no standard treatment, but there are many ways to help minimize the symptoms and maximize their abilities. These therapies include behavioral management therapy, which tries to enforce wanted behaviors and reduce unwanted behaviors; speech-language therapy, which improves pronunciation and learning to speak correctly; cognitive behavior therapy focuses on the connection between thoughts, feelings, and behaviors. This slide is about the gut and brain connection. The gut-brain microbiome axis refers to the highly integrated interactions and communications between the central nervous system and the GI tracts, as well as the trillion of microorganisms that inhabit the gut. This plays an important role in autism spectrum disorder. People with this disorder typically suffer from GI symptoms, and children that suffer from these GI symptoms typically seem to be perfect candidates for autism spectrum disorder. The autonomic nervous system, which regulates physiological processes like heart rate, blood pressure, respiration, digestion, as well as the enteric nervous system, which is a division of the autonomic nervous system. It is also nicknamed the second brain, which is basically a system of neurons that govern the function of the GI tract. And the neurotransmitters, the hormones, and immune responses all communicate through the gut-brain axis. The neurotransmitters produced in our gut directly impact our emotions. For example, serotonin, which controls mood. And 90% of these neurotransmitters are produced in the gut. Bacteria in the gut converts tryptophan into serotonin, and tryptophan is a substrate for the synthesis of a serotonin. Basically just an amino acid, which is essential to make proteins that help the body function properly. No particular bacteria has been consistently changed in these studies, but many microbial imbalances were found, and this could be because of different aspects like diet, age, your gender, population, and the severity of autism. They especially notice a decrease in Bacteroidetes firmicutes phyla ratio, which supports the theory that ASD patients have a normal digestion of carbohydrates. And this bacteria just provides protection from pathogens / digest polysaccharides, which are just long chains of carbohydrate molecules, which is found in most food. Some studies have found high levels of actinobacteria, and they typically aid in digestion, but too much can lead to dysbiosis, which is just a shift or change in the composition of the microbiome. Mother's effect on the baby's brain. The gestation period of a pregnancy, and the gestation period is just the time between conception and birth. This plays a pivotal role in the brain development of the fetus. The dysbiosis of the maternal microbiome can cause abnormal brain development of the baby, and poor nutrition of the mother also directly impacts the neurodevelopment of the baby. Also, the mode of delivery, if they're born through C-section or through the vagina. Studies show that the C-section have a higher risk of developing autism versus those that are born through the vagina, and this is because of the bacteria they are exposed in those different environments. And the gut of the fetus is pretty much identical to the gut of the mother during birth. And this is my citation.